All right, so today what I'm going to be doing is working on my assistant like she has frozen shoulder. This comes in our office, and a lot of patients want to know what we do for frozen shoulder. So one big thing I'll do to a patient with frozen shoulder is I try to make sure that we can get it to its full end range of motion everywhere, as well as I'll put my hand on the shoulder and impulse the muscles strategically. And this is a type of therapy that doesn't get better in one session. It takes multiple sessions. So Maddie, I'm going to have you turn over right now. It gets better incrementally. So now that Maddie's turned over, it's this shoulder we're working on. I'll come up to her rhomboids and I'll have her, Maddie, lift your shoulder as far as you can go. Good. And I'm just breaking up as much scar tissue that I can and all these muscles surrounding the shoulder, including the serratus anterior and the deltoids. And I'll tell Maddie to raise her arm like she's bringing it to her back pocket. Good. Now raise your arm like you're bringing it to your top of your head. And now we got more different parts of the muscle exposed so you can get in there and work on it. Last thing I'll do at the end of this is I'll have Maddie turn over. So there's two techniques we can do to follow up with this. One of them is a Graston technique where I'll use a special tool and I'll dig into Maddie's shoulder to break up the scar tissue in there. The next one would be using this ultrasound. What that's doing is using sound waves and heat, and it helps bring more fluidity in that shoulder so that way we can get it to more end range of motion and we can hopefully restore that frozen shoulder back to its normal shoulder. It typically, what I've seen for frozen shoulder can last anywhere between 3 to 8 weeks. 6 weeks is about the average that we deal with in our office. So if you're coming in with frozen shoulder, you're going to notice it's going to get better and better. You're going to get a little bit worse, and then it's going to get better and better, but it definitely doesn't come in one treatment and you're back 100%. I really wish it was like that because they're a little bit of a pain in the butt, but we'll take care of you if you got it.